Okay, so good day to everyone. Let's start with the important points for your skeletal system. So what are bones made up of? Yan. So as you can see, it's made up of collagen and calcium phosphate that makes our bones hard and strong. So we are familiar with calcium, right? And collagen. Sometimes pag pumasok ka ng Watsons, may mga collagen na linalagay sa yung lotion and things like that. Some people, those who would want their skin and their complexity to be, a little bit fair and the skin is smoothened, ayan, they are taking collagen. And for calcium, we can have calcium on our diet, right? So, when you were little, your parents actually encouraged, or whoever guardian was there, parang it's already part of our culture na iinom ng gatas, di ba? So you have to drink your milk so that you will grow, you will get enough nutrients, especially in babies. So we are encouraging breastfeeding. But we are not actually discriminating formula feeding also. Kasi mahirap din naman ipilit yung breastfeeding. Paano pag wala talagang milk yung mother, or the mother is working and the baby has to be left at home. So the baby has to really resort to formula feeding. Anyway, in formula milk, there are also nutrients, minerals, vitamins that you can get. It's just that it's not the same with the breast milk. Kasi ang breast milk talagang kumpleto siya. And there are antibodies that will protect the baby from, infection, developing diseases, and different risks of stunted or delayed growth and development. Ayan. So, bones store calcium and release some into the bloodstream when it's needed by other parts of the body. So, this combination of collagen and calcium makes bones strong and flexible. Yung flexibility is we attribute it to the collagen. And the strength of your bone is we attribute it naman to the calcium content. The amount of some vitamins and minerals that you eat, especially vitamin D and calcium, directly affect how much calcium is stored in your bones. Okay, so these are the functions of our skeletal system. Of course, very self-explanatory na yung movement, support, protection. So the example here says your ribs or your thoracic cage. So if you can see this one, it protects your heart and your lungs. Then it also makes blood. So red and white blood cells are formed by tissue called marrow, which is in the center of the bone. So this is your marrow. Ito ang marrow, nasa loob yan ng bone mo. Okay, your skeletal system also functions as a storage. So this was already mentioned earlier. So the calcium and phosphorus is stored in your bones. Again, this is the summary of the function. So it's support, protection, movement, storage, and blood cell production. So let's go to bone ossification. What is bone ossification? It is the formation of bone by osteoblasts. In short, ang term na ossification ay yung paggawa ng bone mo or bone formation. After an osteoblast becomes completely surrounded by bone matrix, it becomes a mature bone cell called osteocyte. So una, osteoblast muna siya. Pag nang-mature siya, nagiging osteocyte. These are the 4 categories of bone according to shape. So we have long bones, short bones, flat bones, and irregular bones. Okay, so those are the examples of each. Then your 2 major skeletal system parts include the axial skeleton and the appendicular skeleton. The axial skeleton includes the skull, ribs, spine, and sternum. For the appendicular skeleton, it includes the appendages of the body, which are your shoulders, arms, hips, and legs. Ayan, so these are the 4 layers of your bone. We have the periosteum, which is the outermost layer, then followed by the compact bone, which is the hardest part, the spongy bone, which lies beneath the compact bone, and then your bone marrow. Okay? Ayan, so this is the compact bone, then your spongy bone, and then we have the bone marrow. So this is also the typical structure of a long bone. So you take note of this, the diaphysis, the epiphysis. So parang yung ball joint nga na ano natin, formation ng ating like for example sa hips and sa legs mo. So ito siya, example ng bone. Ito yung papasok doon sa pelvis. And then we have here the spongy bone. So this is the spongy bone. The compact bone is this one. Compact meaning siksik. Ayan, your periosteum is the outer layer. There. Okay, so again, the diaphysis and the epiphysis. Kasi na-mention yan lagi yung terms na yan as we go along. So, just read through this. These are facts about compact bone. Ayan. So, the compact bone is made of special cells called osteocytes. Ano ulit ang osteocytes? Diba, ang osteoblast, if we talk about bone ossification or the formation of your bone, una muna siya ay formed by osteoblasts. These are cells ha. Cells ito. So, osteoblasts become mature and then it becomes osteocytes. So, together, a canal and the osteocytes that surround it are called osteons. Here, oh. So, osteon, ayan siya. These are your osteocytes. The osteon is the whole in itself. And the osteocyte is the inner orange thing or brown thing. Okay? So, ito yung buong osteocyte na siya. Okay, so this is the things you need to know for the spongy bone. So, it's very self-explanatory naman ang spongy bone. So, ang spongy bone, nandoon siya sa loob na ng compact bone. So, ito. From the word spongy, di ba? Yung sponge, ganito itsura. Ayan. O, kitchen sponge. Meron tayo niyan lahat. Okay, so pores are filled with marrow, nerves, and blood vessels that carry cells and nutrients in and out of the bone. Ha? So, ang marrow ay nasa loob na siya ng spongy bone. Though spongy bone may remind you of a kitchen sponge, this bone is quite solid and hard and is not squishy at all. So, hindi siya soft. Katulad ng kitchen sponge. Okay, in the spaces of many bones, there is a soft connective tissue called your marrow. So, there are diseases that require marrow extraction. Sometimes it is extracted, or most of the time actually, it is extracted on your spinal column. So, it treats kasi, in your marrow, there are stem cells. And these stem cells can form into any cell your body actually needs. So, for example, if you are having a disease in your kidney, ang stem cells ay pwedeng i-inject sa'yo at mag-form siya ng bagong cells na kailangan ng kidneys mo. So, ganun ka-powerful ang stem cells. There are two types of marrow. We have red and yellow. The red marrow produces most of the body's blood cells. Yellow marrow naman stores fat that can serve as an energy reserve. Again, yung red marrow, yan ay nag-produce ng blood cells mo. Or your red blood cells, white blood cells. Your yellow marrow naman stores fat that can serve as energy reserve. The inside of your bones are filled with a soft tissue called marrow. So this was mentioned earlier. For red marrow, it is where all new red blood cells, white blood cells, and platelets are for clotting. So all of these are made in the red bone marrow. Yeah, so platelets are small pieces of cells that help you stop bleeding when you get a cut. So when we discuss about blood, heart, and blood vessels, we will be able to encounter again the term platelet. Your yellow marrow is mostly made of fat. It does not make blood cells or platelets. So, ano lang siya, for energy reserve lang talaga siya. Bones are made of four main kinds of cells. So, we have osteoclasts, osteoblasts, osteocytes, and your lining cells. Notice that the three, ito 1, 2, 3, they start with the term osteo. This is the Greek word for bone. So when you see osteo as part of a word, it lets you know that the word has something to do with bones. Like for example, osteoporosis, right? So madalas nating naririnig yan. It's a kind of disease also concerning your bone. Osteoblasts are responsible for making new bone as your body grows. Kasi nga 'di ba, in bone ossification, ang gumagawa or in bone formation, ang unang gumagawa ng bone mo ay osteoblast. Pag nag-mature na ang osteoblast, tinatawag na siyang osteoclast. Okay, the second part of the word blast, here comes from a Greek word that means growth. So bone, growth. 'Di ba? Osteo is bone and then blast is growth. It means bone growth, right? Minerals are then added to osteoid, making it strong and hard. When osteoblasts are finished making bone, they become either lining cells or your osteocytes. Osteocytes are star-shaped bone cells most commonly found in your compact bone. They're actually old osteoblasts. An osteoblast build bone, they pile it up around themselves and then get stuck in the center. At this point, they are called osteocytes. So nag-i-stuck your osteoblasts are formed and then yung buong maraming osteoblast tinatawag na siyang osteocytes. Osteocytes have long branching arms that connect them to neighboring osteocytes. This lets them exchange minerals and communicate with other cells in the area. Ano naman ang osteoclasts? So tatlo, 'di ba? Osteoblast, osteocytes, osteoclast. Okay, so kung bone formation ang iniisip natin, ang formation, ang concern lang sa formation ng bone ay yung osteoblast at yung osteocytes, ha? So ito lang, wait lang. Saan ba yun? So, osteoblast lang and osteocytes lang ang concern sa bone formation. Pag osteoclast na ang pinag-uusapan natin, it breaks down and reabsorb existing bone. So, hindi na siya kasali sa formation. Nandoon na siya sa breaking down, ha? The second part of the word clast comes from the Greek word break. So, osteo means bone, clast means break. So, breaking of bones or bone break. Ayan. Osteoclasts are very big and often contain more than one nucleus which happens to when two or more cells gets fused together. These cells work as a team with osteoblasts to reshape the bone. Ayan. Lining cells, they are very flat bone cells. They cover the outside surface of all bones and are also formed from osteoblasts that have finished creating bone material. These cells play an important role in controlling the movement of molecules in and out of the bone. When a bone breaks, so pag ikaw ay nagka-fracture, a thick lump of bone called a hard callus forms around the break in the process of healing. So later, I will be discussing this in detail because I have an illustration later that I will show you on how or what happens when a bone breaks. So bone repair actually happens after there is a fracture in our bone. Bones that are used more often and need to support more weight, such as the bones of athletes, become thicker and stronger over time kasi ginagamit mo siya eh. So nade-develop din siya. It's also like your muscles. If you are doing exercise, cardiopulmonary exercises, and you lift heavy objects, so your muscles develop, they get bigger and bigger. On the other hand, bones that are used less often, for example, the patient has been comatose for a month or kahit 2 weeks nga lang eh. 2 weeks with no activity, your muscles shorten, your bones also shorten because there is no activity. Yan. So if you are a patient and then you are to be put into a cast for long periods of time, your bones become smaller and thinner. Okay, let's discuss bone growth. Bone growth occurs when deposition of new bone or lamellae onto existing bone or other connective tissue happens. So ano ba ang lamellae? Deposition, ibig sabihin, ikaw ay parang iniimpok mo siya. Pinagtatagpi-tagpi mo, iniimpok mo, ganyan. So, ano bang lamellae? Lamellae are thin sheets of extracellular matrix composing the bone itself. Ha? So, for bone ossification, the responsible cells in that are the osteoblasts and osteocytes. Pero, as to what actually composes the bone itself, it's the lamellae. Ito. So, lamellae are thin sheets of extracellular matrix. Ano naman ang extracellular matrix, ma'am? Extracellular matrix contains collagen, ground substance, and other organic molecules as well as water and minerals. So, meaning collagen, ground substance, organic molecules, water, and minerals compose your lamellae. The bone, cartilage, tendons, and ligaments of the skeletal system are all connective tissue. So, we also have a lesson, di ba, yung tissues. So, there. We have connective tissues, epithelial tissues. Let's go to bone remodeling. Bone remodeling is the removal of existing bone by osteoclasts. So, ang napansin nyo sa bone remodeling, ang involved na dito ay yung osteoclast. Ano ulit ang osteoclast? Ang osteo is bone, clast is to break down. So, the breaking down of bone. And the deposition of bone by osteoblast. Kasi pag ikaw ay nagre-remodel ng isang bone, syempre, nagbre-breakdown muna siya bago mo siya lagyan ulit or bago mo siya i-deposituhan ulit ng osteoblasts. Remodeling is responsible for changes in bone shape, the adjustment of bone to stress, bone repair, and calcium-ion regulation in the body fluids. It is also involved in bone growth when newly formed spongy bone in the epiphyseal plate forms compact bone. Ito na, bone repair. Blood vessels in the bones are damaged when a bone is fractured. Bakit? Kasi nga meron kang bone marrow. Bone marrow, meron kang ano ulit? Red marrow, yellow marrow. Yung red marrow mo, doon nang gagaling yung red blood cells, white blood cells, platelet, di ba? So, pag na-fracture ka, affected ang blood vessels mo. A fractured bone needs to be repaired. So, these are the stages of bone repair. We have hematoma formation, callus formation, callus ossification, and bone remodeling. So, ganito ang itsura niya. Pag ikaw ay na-fracture, ayan. So, naputol siya dyan. Magkakaroon ka ng hematoma or dugo muna ito. Heme is blood. Hematoma formation, dugo muna siya. So, magkakadugo muna siya dyan. Ang problema ngayon, pag ikaw ay hindi nag-consult ng isang surgeon or orthopedic doctor, hindi ito ma-fix. Ganyan lang ang itsura niya, which is dapat kailangan ma-align, di ba? Kailangan ma-align. Siya ay nakaganyan siya ngayon. So, saan ma-form itong hematoma? Diyan. Ibig sabihin, liliko siya yung bone mo. Pag nag-form siya ulit, hindi na siya straight. Pag hindi ka nagpa-cast, yan ang ibig sabihin ng casting. Ang casting, kaya parang sinisimento yung ano mo, yung bone mo para in a few months time, mag-align uli siya. Kahit naputol siya dyan, pero pag pinagtugkop mo, dito magfo-form yung hematoma. O, straight pa din siya. So, lalagyan ng cast dyan. Ganyan. Kung ganito, pinabayaan mo o kaya pinahilot-hilot mo lang, may mga instances na hindi pwedeng mag-align yan o hindi magdidikit kasi hindi ka nagpa-x-ray. Diba? So, ang mangyayari, tabingi ngayon yan. Oh, you will also undergo bone repair. Yes, of course, because all of us, all bones do repair. But, in terms of straight ba siya, baliko ba siya, it will matter kung ikaw ay nag-consult ng doctor at nagpa-cast ka. So, pag ganyan, hindi ka nagpa-konsulta, tabingi, magiging irregular yung bone mo, gaganong-ganon siya ngayon. So, dito magfo-form yung hematoma una. Blood released from damaged blood vessels form a hematoma. Di ba nga, sa loob ng bone mo, sa loob ng spongy bone, nandoon na yung marrow. So, pag yan ay naputol, syempre, magkakaroon ng dugo. Lalabas yung dugo. Itong dugo, ito na ngayon yan. Ang nag-form ng hematoma mo, yung dugo mismo na galing doon sa marrow, sa red marrow mo. Yan ang hematoma. And then, your hematoma formation is followed by the callus formation. Ito na siya. Ano, sa term natin, ang callus ay Sa waray-waray, kibal. Sa Tagalog, ano bang Tagalog ng kibal? Kayo na mag-isip, hindi ko maisip. Callus formation. The internal callus forms between the ends of the bone and the external callus forms a collar around. Yan. So, from the hematoma, ito na siya, nagiging callus. And then, nagka-callus ossification. So, yung bone formation mo ay nag-start na uli. Ayan. Woven spongy bone replaces the internal and external calluses. So, nag-start siyang gumawa ng bone uli. And then, bone remodeling happens. Compact bone replaces woven bone. Bakit? Ang spongy bone mo, over time, is nagde-develop siya into compact bone. Okay, calcium homeostasis. Calcium homeostasis is maintained by 3 hormones. We have here the parathyroid hormone, the vitamin D, and your calcitonin. Parathyroid hormone and your vitamin D is secreted when your blood calcium level or kung ang calcium mo ay low, yung calcium mo sa katawan mo ay low, nagsisecrete ang body natin ng parathyroid hormone and vitamin D. Pag ang blood calcium levels mo ay masyadong mataas or too high, calcitonin naman ang nare-release. So, ganito siya, oh. If there is decreased blood calcium, this image is found in your book, ha? You can refer in your book also. So, if there is a decreased blood calcium, ayan, na-activate ang parathyroid glands, your parathyroid gland, your thyroid gland, which releases the PTH or your parathyroid hormone. Okay? And then your kidney is involved where the vitamin D is actually being released and processed in the small intestine at nandoon na siya. So, from your small intestine, doon na yung vitamin D papasok sa bloodstream mo. Okay? So, it stimulates osteoclasts in your bone. Osteoclasts promote calcium uptake from your bone. Then, pag increase ang blood calcium, anong hormone ang involved? Ito, calcitonin. Yan, ini-inhibit naman niya ang bone na mag-release ng calcium. Sabi niya, oy bone, huwag ka nang mag-release ng calcium dahil sobrang dami na. Pag sobrang baba ng calcium, ang body mo ay nag-i-stimulate ng mga parathyroid glands mo, thyroid gland, para mag-release ng ano uli? Parathyroid hormone at vitamin D. So, ito naman ay pupunta na sa bloodstream mo para nga ma-absorb yung maka-help mag-absorb ng calcium. Di ba ang vitamin D tumutulong para ma-absorb natin yung calcium? Okay, so yung parathyroid hormone mo naman, ini-stimulate niya yung bone mo. Sabi niya, hey bone, you release more calcium kasi low ang calcium ng katawan. So, pag mag-release ang bone ng calcium, pupunta na din siya sa bloodstream mo o sa dugo mo. Mare-regulate ulit siya sa katawan mo. Okay, naintindihan? Ganun lang yan kadali. So, there are illustrations or images in your book that may overwhelm you. Hala, ang dami-dami namang nakalagay. Ano yan? Hindi ko na maintindihan. Alright, so if we see each other again for health assessment, I will be able to reinforce the information or the things that you really have to learn and understand for anatomy and physiology because I will still be your professor for health assessment. So, how do bones develop? As an infant, most of your skeleton is cartilage. Kaya nga ang infant ay very, very soft, very fragile. Talagang iingatan mo siya kasi madali siyang madaling magka-fracture ang babies. Cartilage is a strong, flexible tissue. Over time, the cartilage is replaced by solid bone, usually complete by the time you stop growing. Not all cartilage is replaced in adults. Many joints contain cartilage, protecting the ends of bones like the ears and the end of the nose. So, eto siya. Yan, may cartilage dito. So, eto na. These are the basic parts of your skeletal system. We have the clavicle, the scapula, and then the 5 spinal regions, which is the cervical, the thoracic, the lumbar, the sacral, and the coccyx. The sacrum and the coccyx both play significant roles helping to support and stabilize your vertebral spinal column. So, just a short sharing on this matter. When I was in college, I had an accident. So, na-slide ako. Yung una kong prinotektahan kasi yung ulo ko. So, yung arms ko, rinap ko siya sa ulo ko para yung ulo ko hindi siya talaga mabagok. Ang nangyari, yung tumama sa sahig ay yung shoulder ko at yung sacrum and coccyx ko. So, until now, talagang may mga instances na sobrang sakit niya kasi I did not undergo physical therapy at that time because nursing was very strict. Absences when I was in college it was a big no-no. So, kahit sobrang sakit ng nararamdaman ko, I went to the doctor actually. But the doctor just, he did not prescribe any X-ray or whatever diagnostic or laboratory checks I should go through, but he gave me pain relievers kasi sabi niya nakakalakad ka pa naman, so it means that there are no fractures, sabi niya. So sabi ko siguro nga kasi nakakalakad nga ako, pero yung sobrang sakit niya, I had to take 2 days off at most so sabi ko sa dean namin, I really have to rest for 2 days. So until now, parang every night gusto ko nagpapamassage muna ng sacrum and coccyx area. So dito. Sobrang relaxing din naman pag minasage mo siya dito at dito. Kasi if you are standing, yung weight mo talaga ay nandito. Ito yung nagdadala ng bigat ng upper body mo. Ito. Okay, so we have the humerus, the radius and ulna, the carpals, and the metacarpals, and your phalanges. Okay, then we have the rib cage. Okay, so your lungs are situated here and your heart. So, yeah, it serves as a protection. Your sternum, your pelvis. Okay, the protection of your internal organs on the lower abdomen. Yan, your reproductive system is also there. So, yan, your pelvis, femur, the largest bone in the body. Then we have the tibia and fibula. Okay, so kung akala mo ang lower leg mo ay isang bone lang, mali po tayo, dalawa yan. We have tibia and fibula. Then you have here the tarsals. The metatarsals. So ito yung tarsals, metatarsals, and these are your phalanges. There, the phalanges. Same as your fingers, you have phalanges. Okay, so let's go to joints. These are the different types of joints. A joint is a place where two bones come together. Joints allow the bones to move in different ways. There are two types of bones. You have immovable and movable. Okay, so yan. These are the movable joints. Meron tayong ball and socket. So like your shoulder, we have the pivot, which is in your elbows, and the hinge, which is found in your knee. Bones in movable joints are held together by a connective tissue called ligament. So ito, you may wonder, ay, bakit hindi siya naghihiwalay? Kasi merong ligaments dyan na nagko-connect. So dito, may ligaments, may ligaments. Yan. So we have 4 types of movable joint. We have hinge, ball and socket, pivot bone or joints, and gliding joints. Yan. So this is the ball and socket. Very self-explanatory naman na to. Ayan, the acetabulum of hip and the head of your femur. So your hip bone and your femur or your leg bone. Ayan, this is naman the hinge joint. Example, knee and elbow. So the hinge joint is shaped to restrict movement to one plane only. Ayan. Pivot joint. So here in the example, ang pivot joint ay parang neck mo. So you can look at the right, look at the left, up, down, and you can rotate. Pero hindi 360 degrees, ha? Para kang aswang ka na pag nakapag-rotate ang ulo mo ng 360 degrees. Then we have a gliding joint here. So, gliding joint allows one bone to slide over another, like your knuckles, your wrist, ankle. It allows you to bend and flex as well as make limited side-to-side motions. Ito na. So, sabi ko kanina, bakit nagdidikit yun? Yung ito, oh. Wait lang ha, balikan ko lang. Sorry. Oh, ba't nagdidikit ito? Kasi meron siyang ligaments. Hindi pwedeng bone lang siya dyan talaga. Wait lang ha. Bear with me. Okay, here is the ligament. Ayan o. Kung titingnan nyo, para siyang tissue paper or elastic bands or mga buhok na talagang nakakabit sa bone mo. Oh, nakakabit siya. Ayan. Para hindi maghiwa-hiwalay. That's your ligaments. And tendon is a different thing. Your tendon is or has involved na dito ang muscles mo. Ayan. Tendons carry tensile forces from muscle to bone. They carry compressive forces when wrapped around bone like a pulley. So, ayan. And your ligaments maintains correct bone and joint geometry. Ayan. We also have cartilages. So, elastic cartilage is the most flexible, is found in your ear. Kaya nga ang ear mo, kahit perikutin mo siya, ayan, o babalik pa rin siya sa original niyang posisyon. Then we have for the nose and ribs, we have the hyaline cartilage, second most flexible. And for the knee and vertebrae, meron siya doong fibrocartilage. This is the least flexible. Okay, so ito ang cartilage. Ayan, that white material. So it supports soft tissue, it keeps trachea open, it cushions your vertebrae or your spinal cord, it provides soft gliding surface at articulation joints, and provides model for formation of new bone. So tatlong types niya, ito nga yun, ang tatlong types. Okay? And then, ito na. I-differentiate natin siya yung tatlo. We have the cartilage, the tendons, and the ligaments. So, your cartilages are tough. They are also flexible. And they are found at the end of your bone. They serve as a cushion. For your tendons naman, your tendons, isipin nyo na lang, pag tendons, may relationship siya to the muscle. So, they are attaches bone to muscle. They are sturdy, non-elastic, size changes depending on muscle, and they serve as an anchor. Kasi anchor siya. Ang anchor mo, dapat sturdy siya. Anong sturdy? Hindi siya na gagalaw-galaw sana, di ba? Anchor pa nga anchor nga para doon ka lang. Kung ano yan, kung ship, you are riding a ship, you release the anchor para yung ship mo hindi matangay ng dagat or ng agos. Ganon. Alright, for ligaments attaches bone to bone. So, if ligaments, it is bone to bone. For tendons, it is bone to muscle. Your ligaments are elastic because it aids in movement of your bones that are connected to each other, diba? So, it serves as stabilization. It is made of many fibers and it is strong. Okay, so yun lang naman ang important things for your skeletal system.
The skeleton changes across the human lifespan. This is characterized predominantly by bone formation and growth throughout childhood, followed by a gradual loss of bone density that begins in early adulthood that can accelerate significantly in older adults. The density of bone is modulated by a group of cells including osteoclasts, which are multinucleated cells that resorb bone, and osteoblasts, which refill the resorption cavities created by osteoclasts. Osteoclasts anchor themselves to the surface of bone. This creates a microenvironment underneath the cell, which is referred to as the sealed zone. Within this zone, the osteoclasts create an acidic environment that dissolves the bone's mineral content. Once the mineral content of the bone has been dissolved, enzymes released from osteoclasts remove the remaining collagenous bone matrix to complete the process of resorption. Following resorption, osteoblasts move into the resorption space and start to produce and deposit organic matrix called osteoid. Osteoid, a substance made predominantly of collagen, forms a scaffold in which minerals including calcium and phosphate begin to crystallize. Some active osteoblasts become trapped within the matrix they secrete and thereby become osteocytes. Other osteoblasts will undergo apoptosis or will revert back to lining cells which cover the surface of bone. This cycle of bone resorption and formation is referred to as remodeling. There is also a process where bone formation by osteoblasts occur without prior bone resorption by osteoclasts. This results in an increase in bone mass and is referred to as bone modeling. Bone modeling promotes the growth of bones and is important for maintaining bone strength. Remodeling also plays an important role during bone growth by optimizing the growing structure. After the age of 30, most people experience a gradual loss in bone mass due to a relative decrease in the activity of osteoblasts compared with osteoclasts. However, there are many factors that impact the process of bone remodeling and influence the degree of bone loss we experience as we age. For example, medications such as glucocorticoids, which can promote osteoclast activity and also reduce bone formation. Proper nutrition and physical activity can help strengthen bone. It is also believed that osteocytes form a complex network in bone that can sense any increased workload on the bone and respond by triggering the differentiation and activity of osteoblasts to increase bone density. Conversely, when bone experiences reduced loading conditions, such as during long-term bed rest, resorption and remodeling increase to eliminate underloaded bone. Loss of bone mass reduces its strength and increases the risk of fracture. This highlights the importance of staying active, maintaining good nutrition throughout life, and being aware of personal risk factors associated with low bone density. Our skeletons have evolved to be able to resist most fractures, but the extreme loading associated with trauma can create sufficient stresses and strains within bone tissue to cause fractures. Following the fracturing of bone, a blood clot forms between the two broken bones. Various inflammatory mediators are released at the site of damage, which recruits cells involved in the repair process. Following inflammation, connective tissue, such as cartilage, starts to form around the site of the fracture, forming a bridge between the ends of the broken bone. New blood vessels form by the process of angiogenesis to replace the vessels that were lost as a result of the fracture. Cells associated with these new blood vessels are involved in osteogenesis, or the formation of new bone tissue. Osteoblasts rapidly form woven bone, bridging the gap between the two pieces of broken bone. Once the fracture has been bridged and stabilized, remodeling occurs, in which osteoclasts, together with osteoblasts, remodel woven bone callus to normal lamellar bone, and to gradually restore the typical bone structure. While extreme loading can fracture any bone, fragility fractures can occur with less than extreme loading because of skeletal aging and structural decay. Vertebral collapse is often secondary to osteoporosis and is more prevalent in women. Loss of bone mass can be accelerated following the onset of the menopause, which can give rise to osteoporosis. This loss includes early and progressive declines in trabecular bone, which is more metabolically active, along with progressive declines in cortical bone. Cortical bone comprises 80% of skeletal mass. Cortical bone loss, caused primarily by increases in cortical porosity, may contribute to the increased risk of fracture. Another common fracture site is the hip, which is comprised of both cortical and trabecular bone. It is thought that cortical bone may play a greater role than trabecular bone in maintaining bone strength at the hip. fractures of the hip have been associated with substantial morbidity, mortality, and healthcare costs. These events underscore the important role of cortical and trabecular bone in resisting fractures and highlight the importance of maintaining a lifestyle that helps to build and preserve bone strength. It is also important for older patients in particular to be aware of their personal risk of fracture and seek medical advice on how best to reduce that risk.